Well, we are right at 7 o'clock, so we've got people joining us. Hi to everyone. I'm Emily Miller-Lair. This is Adam Nodell, and this is Rebecca Keto, or do you prefer to be called Becky?
Becky, yeah.
Becky. And we are here so you can ask us anything. These two are the star. I'm more of the moderator. If you want to ask a question, some quick housekeeping, if you hover over the bottom, you'll see a little Q&A section. You can ask any question you like through there. These guys are going to get it answered for you openly and honestly. And that's pretty much the crux of exactly what we're doing here. We just want to make sure that you get all of your questions answered, and feel free to load them at us. All right. So our first question is, what option, let me make sure I get this one right. What options you may see me looking over, I'm just picking up the questions. So what options did you look into coming out of school, and why did you choose Aspen? So let's start with you, Becky. What options did you look for coming out of school, and why did you choose Aspen?
So coming out of school, I've been a clinical dental hygienist for about 10 years, and Aspen was not my first job. I worked in private practice. I temped for a little while. I worked in like other dental support organizations. And so I kind of got a taste of everything. And there was things that I liked and things that I didn't like, with everything. And I ultimately chose Aspen because I knew that they valued and respected their hygienists for their expertise. And I knew that I wanted to be able to kind of move up a little bit in my career. And so that's why I joined Aspen and worked clinically with them, and then ultimately got to move up into a hygiene support position. And my career with Aspen has been great.
And I'm going to get a little nosy on this one because I know that you knew, but I want to ask, how did you know about Aspen, or how did you hear about us?
I actually had a classmate that I went to school with, and I kept seeing every time I would talk to her, she would tell me about how amazing it was. And I said, yeah, I've worked for places like Aspen before. No, there's always, they pressure you, or there's always things. And so I joined thinking, oh, I'll be there for a little while. And I loved it from day one. I had autonomy as a provider to really take care of my patients the way that I wanted to. I was valued by my team members, by my doctor. I was respected for my expertise. And I had a great company as well, as far as support system and training and development and learning. And I've just really, really enjoyed my career with Aspen.
Oh, that's really awesome, Becky. Thanks for sharing that. I was always curious. I knew that you had heard about us because you and I have worked together before. And I thought to myself, I wonder how she knew about us. So that was really interesting to know. And I should have introduced you. So thanks for doing a great job of introducing yourself and telling us a little bit about yourself. So Adam, if you could tell us a little bit about your career and why you chose Aspen, I'll give the floor to you.
Thanks. Well, so I'm lead hygienist for Albuquerque. And I've been working clinically about 2.5 years as a hygienist. And I started out actually as a dental assistant. And, my story is kind of funny because actually, I had been in tech support, and I had, before that, and I had actually been in like construction and some other fields. And so I was doing a bathroom remodel for my dentist at the time. And yeah, and it was funny because he was like, you're really good with your hands and you're good with people. Let me know if you get into the dental field. And that's cool. I thought that was super funny because I was doing a bathroom remodel, but it kind of stuck with me. And one of my friends ended up going and becoming a dental assistant. And so I went to school and became a dental assistant and ended up working for that same dentist. And then he transitioned his practice over to a younger dentist. And so I worked for him for a little bit. And I kind of always saw the hygienists off to the side doing their thing. And it interested me. So I thought about, so I became an assistant for a hygienist, and to kind of see what it was like in the trenches, to see what, it really was like, and to be a hygienist and work close with them. And I did, and it looked awesome. And so I went to school, became a hygienist, My wonderful wife really helped me kind of get through that program and supported me. Um, and I made it as I graduated. And the way I kind of came across Aspen is, I don't know, do you know Ryan Lucio?
Yeah.
Yeah. Okay. So Ryan was the regional manager for our area at that time, and Cameron was doing what I believe what you do now, Becky, but it was sort of like an integrated role between you two. But I'm not sure. But at any rate, things were a little different at that point because we were just breaking into New Mexico and kind of getting in. But Ryan came to our school as a to kind of recruit and also just let us know that Aspen was coming into New Mexico and what it was all about. And the minute he started talking to us, I just felt like, and explained kind of what the vision was. It really spoke to me because my mouth is not perfect. Like I said, I'd been in other fields. I grew up poor, but loved, but poor. And so I had a lot of wear and tear on my mouth. And it was cool to hear about an organization that kind of specialized in rehabilitating mouths and then also had a whole built-in lab. So, one of the things that makes Aspen unique is that we have a built-in lab. We have lab techs that we're very specific about hiring, and we want that to be an integrated process because when you rehabilitate a mouth, you want to make sure it has structure placed back into it. And I know how that is because I've had to wear a partial. I know what that's like. And so it was kind of cool to hear about a place that really focused on that and folks that need that sort of thing. And so I got his information, and when I graduated and took my boards and everything went well with that, I had tried to apply. And at that time, the way the system was set up, I tried to apply online and I couldn't get through. But it was really cool because Ryan actually ended up calling me because he remembered me. And so that was an answer to a prayer because I knew when I got out of school, I ended up loving hygiene. And so I knew when I got out of school that no matter what, I was pretty sure I'd find a job, but I wanted to find a job where I'd be really happy. And I felt like Aspen was it. And so I'd been laying down some prayers, and and it was cool to have him call me back. And it felt like an answer to that prayer. Went and interviewed with him, and that was it. And I've been kind of with Aspen ever since. And so sorry, that was a long time, but that's my story. And that's how it kind of all came together.
That's really cool. I love hearing that someone just gave you that idea and it really opened up where you went with your career. So super, super, really cool story. One thing that that Becky kind of talked about a little earlier that we want to ask a question about is you talked about you had heard that dental service organizations like Aspen apply a lot of pressure on their hygienists. In your experience, do you feel that pressure or is there pressure? What would be your response to that after actually working for Aspen?
So I would say that I don't have pressure. When I worked clinical dental hygiene for Aspen, I was completely empowered to really take care of my patients, to really, we do a full perio charting and a full perio assessment of all of our new patients and our recall patients. And so, if we're seeing active infection, we're empowered to take care of it. And so it's more of, at Aspen, we have a motto of do what's right by the patients and, the business will follow. And I really truly believe that. And I always felt empowered to do what was right by those patients and to make a difference in their lives and to give them, quality hygiene services so that you really see their mouths heal and you gain that trust and respect and you gain a patient for life. And it's the best feeling as a hygienist. That's what we all come to work to do every day.
Yeah, I love that. And I love that it was different than you had originally perceived it, but it turned out to be exactly what you were looking for. That's
yeah.
really cool.
Yeah.
So Adam, speaking of do right by the patients, I know that's something that's always your motto. Can you talk a little bit about what a DSO is and how that works for you to do right by your patients?
So yeah, I completely agree with what Becky said. Like I've been at places where that's not how things go. Things are a little bit more forced. And I'm grateful for that opportunity because that's what turned me on to Aspen. I was like, I don't want something like that. And Aspen said it wasn't. And I'm happy to report that that's the case, and so when a dental support organization is, or a DSO, or a dental service organization, it's kind of a powerhouse to kind of back the practice itself. So what we do when we're talking about helping patients is we're breaking down barriers to them getting the care that they need. And so what that means is being comprehensive in our care. And so not just, taking some measurements and being like, oh, a prophy, regular cleaning. We know that, gum disease is really prevalent in America. And it's important to be measuring people's bone levels, seeing what the clinical attachment loss is, seeing how the contour of the gingiva is, taking the proper measurements with PDs, and then understanding furcation involvement and all of the different aspects that build a periodontium. So all the different aspects that make up the foundation of their mouth. And so when we understand that, and then we help them understand that, that's how we teach them to be comprehensive. So we can show them areas about where they have bone loss, or, where they have inflammation or active infection. And then we treat it comprehensively. And so I keep saying comprehensive, that just means making sure we're handling it the right way. So where appropriate, we're putting in Arrestin or Atrodox. So we're treating it with antibiotics because it's we're talking about a bacterial infection or inflammation. And then, this gold standard scaling and root planing, and explaining what that is to them. And then, also, we have other, making sure that we're giving them adjuncts, writing the prescriptions that we write. We don't have that opportunity just to never use it. I mean, the prescriptions that we write for hexidine and sodium fluoride, all those types of things, they have a purpose. So we're healing all of that disease in their mouth. And so it's important not to be afraid to really approach that and tell, and when they say like, well, I just want a regular cleaning, letting them know, what we're doing here is we're getting your mouth on track because you have disease in your mouth, and then teaching them why that is and how we fix it.
I love that. So basically the dental service organization does all of the back leg work for you, the HR, all the stuff that you don't want to think about, and you get to focus on doing what's right for your patients.
Exactly. I don't diagnose their wallet. I diagnose what's going on in their mouth, or I tell them what's going on in their mouth, and doc helps us diagnose it. And then, we have our DSO organization to help them find out how they can get that done. And that's why we offer a lot of things like, payment plans, or we work with all kinds of different insurances. And the DSO helps us do that really efficiently. It's a kind of a powerhouse, so that in the front end, we can have that really personalized patient care. But on the back end, we have a powerhouse to make sure things get done, and that they can get done, and we can offer those patients, opportunities to get it done and get that comprehensive amount of work done, rather than just what they can barely afford anyway, or basic treatment.
I love that. And you mentioned, and I'll go to Becky for this one. We talked a lot about products or different things that you can choose to use on your patient. First question, are you required to use those things? And second question, how are those products selected?
So no, we are not required to use those things. We believe in the overall picture of a patient's health. So if you have a patient that has periodontal disease, doing the scaling and root planing is definitely going to help to get them back to health. But then, as I tell my patients, we're a team. We partner together. So I don't want you going home and using your old dingy toothbrush. We want to get you with a top of the line electric toothbrush or chlorhexidine, to really help kill the additional bacteria after that scaling and root planing, so that you continue to have that health. And on top of that, then, get them on their recall visits from that point forward. So I am empowered as a clinician to choose whatever, additional products I think would benefit my patients. And we do it case by case. It's not just one product fits all. It depends on the patients and their needs. And it's great to be able to have a selection of products to give to my patients, depending on what they're going to need.
Yeah, there's a big list.
Yes.
You can choose from.
Yeah.
So we're jumping around a little here, but question came in. What advice would you give for a dental student or dental hygiene student to be prepared coming out of hygiene school?
So the advice that I would give a dental hygiene student coming out of hygiene school is to just, have that confidence. You're the provider, you have the license, you're a peer with the rest of us. So just really have that confidence and trust in yourself and your skills and what you've learned in school and just really, really own that and know that you have it. And also, on top of that, be open to feedback and things like that, but just really, have that confidence and helping your patients get back to health.
That's such good advice. I will admit, as a hygienist, the first day I remember feeling like I was pretending. Yes. I was a licensed hygienist, but I felt like somebody was going to know that it was my first day.
Is anybody going to watch me do this injection? Yeah.
But the truth is, I had the most up-to-date knowledge of any hygienist within, the state. I had just left hygiene school. That's when you know the most that you're probably going to know memorization wise and all the clinical answer. I mean, you gain knowledge and there's more to learn, but the most technical skill is right there. The most, I guess, didactic skill might be the better word. It's right there. But I remember feeling like I was pretending and bringing my little watch in to make sure I did everything right on time. So
yep.
Adam, what about you? What advice would you give to a new graduate?
Well, I like what you said about the watch thing because it is super important. Well, but it's important because you definitely want to try to keep yourself to the standard. So at school, they really train you to be efficient. And so don't, that's a good thing. But as far as the advice goes, I would say one thing to really think about would be to get out of your comfort zone and just like Becky was saying, really at one, and that you were saying too, Emily, is just really trust in yourself and the skills that you've been taught. And, don't be afraid to get out there and just start doing it, because that's really how you gain the most knowledge really quickly and the most ability with people and learning different situations. And as a clinician, the more experience, the better. So yeah, just go for it and be excited. It's awesome. It's awesome that we get this opportunity.
It is a fantastic career. I mean, if you're doubting it, don't. It's a fantastic career. Oh, yeah. So you mentioned time, and I mentioned time through my little, and I still remember it was like a rubber pink watch. Now they all have Apple watches, and it's probably so much easier. But Becky, talk to us about who sets the time limits, how one goes about setting time limits, because that's a big question we get a lot is, how much time do I have for each procedure?
Absolutely. So, at Aspen, we really, really believe in quality dentistry over quantity. So we do have at a minimum an hour for our recall patients. And then as far as scaling and root planing procedures and an hour and a half for half of a mouth. But that's a loose standard, like I said before, every patient is different. And so if you need more time, you're definitely empowered as a provider to tell the front that, hey, I need more time for this patient. And you're able to do that. On top of that, not to jump ahead too much, but Aspen has a fantastic training program. I remember personally my very first job at a dental hygiene school, the dentist walked me in the op and said, okay, bye, have a good day.
Yes, they did.
About as much training as I got. So we really do a great job of training our new hire hygienists. You get a minimum of 2 weeks with a seasoned Aspen clinician. And the first week, all you're doing is really watching them and just taking in everything and just really learning what they have. And then, the last week, you're doing it, but they're with you the whole time, just kind of making sure that you're comfortable and, just kind of any issues or anything that come along, kind of helping you with that as well. Once you get in an office, then you meet with your office manager, with your team, and decide how much time you want, kind of set your schedule limits and things like that. So you're definitely empowered as a provider to do quality care for your patients, whatever that takes.
Yes, I agree. And just to piggyback off of that, during COVID, and Adam, you can probably attest to this, we added times to what clinicians had scheduled for their times, so you could get used to the PPE. So we really give you what you need in terms of time. Adam, I know you do a lot of training. What would you say to a trainee coming into Aspen? What would be your advice?
The first advice I give is just enjoy the process. Like, enjoy what you're here to do, because that's important. Is just relax and absorb the information. Just like Becky was saying, I've trained a few, 3 or 4 people now, and that's totally the truth of it. Is you give people time to kind of ease into it. We want to train people to be comfortable and to be able to do what they do best, and really reach their potential. And so we give you time to do that. The watch thing, I think it's important for us to stay be professional and try to keep ourselves to a certain standard. And so that's why I say, I think we should definitely still, hold ourselves to a certain standard, because we are clinicians. But it's kind of cool because Aspen lets you do that for yourself. We're autonomous. We're providers. And so Aspen doesn't hold our hand and tell us, this is the time you got to get it done, and here's what you got. And I've been places where that's how it's run. And that's not what we do here. And it's awesome because it really helps you grow and reach your potential, because we're running the business as ourselves. Like, we're treating this as a hygiene business. I teach the people that I teach and that I'm training, I teach them to hold themselves to that standard, because it's their business and they get to represent it, and they get to see how that all comes to play. And but as far as training and teaching them, I think that's the first piece of advice, is enjoy it and really dig in and absorb it, and then don't be afraid to let me know when you're ready, and then we start giving people bigger and bigger cases. So
I love it.
until you're ready to go.
I love that. And it's okay to say when you're ready and when you're not ready, and ask questions. That's what we're all here for.
Yeah.
You did a perfect segue into the next question, which was, and I'll go ahead and ask it to Becky. How involved, now I know in your role now, but even as in your clinical role, how involved in the business are you?
I'm pretty involved in my hygiene business, in regard to, like we said before, we can kind of set the pace for our schedules. I do go into all my new patient exams and do a thorough perio charting and perio assessment with those new patients. I'm also able to order my own supplies for my business, which is great for whatever my patients need. Also, if there's like an instrument that I love, I know when I got into my office, I really love Montana Jacks. And so I was able to order my own Montana Jacks, which changes your hygiene game. So, I am involved in the business as far as that, that regard, and really being able to order for my patients and doing what's right for the patients.
Yeah. Adam, how about you? How do you feel you're involved in the business?
So it's a really cool experience, because I'm a people person. And so that's I probably am strongest in that regard with my career and my focus. But what's really cool about working here at Aspen is the opportunity to learn different skills. And so learning about detail and about ordering and about how to keep my orders together and kind of plan ahead and understand my patients on an individual level and what they might need, and to kind of work with a structure. That was really cool, because it helped me grow in a way that I hadn't quite realized how deficient I was in. Because it was really fun to see I could do a business. And what's really cool about it too is so not only do you get to run your business and you get to kind of call the shots as a provider, and you get to coordinate with your manager and figure out how to best run your business and kind of what you like to see out of how things are structured. But you get a good sense of, the rhythm of the office, and you get a good sense of kind of the nuance of what you do as well. And so it's just been a cool process to get to see how all of that's done. And then, you know, the better you get at running it too, the more efficient you get and the more people you're able to help. And then, you know, what's kind of cool about that is, you know, when you do right by the patient, like I believe it was Becky was saying, and I've heard you say before, when you do right by the patient, everything falls into place with comprehensive care, with taking care of them. And then your business really succeeds and you receive the benefit of that, both financially, but then also experientially. I mean, you just get so much experience, and then you have a business you can feel really proud of. And so that was an aspect of this this career that I hadn't anticipated, and I've grown to really love it. It took me a little while to kind of get it, but what's cool about it is we have help all along the way. Like, you know, how many times have I texted you and asked you questions? And so, and same with Becky, you'll be getting some, I'm sure. I've already asked you some questions, but it's cool because there's always somebody to reach out to help you understand how to run that business. So you're never left like, uh-oh, I don't know what to order, how to order, or, you know, all of it's taken care of. And that's why I say just relax and enjoy it, because it's easy to be the best you can be here.
I love that. I think kind of in my mind, kind of having that business control was part of the autonomy of Aspen. You had the autonomy to do it yourself, pick out the instruments you wanted, you know, do your schedule the way you wanted it to be. It was a level of autonomy that I hadn't seen before. And I thought it was super exciting to see it and then see it work by just doing the right thing. It's amazing. We can make dental very complicated, but you've both said it perfectly. When you do the right thing by the patient, the rest of it falls into place. So it's not super complicated to be a big part of the business and have that autonomy. I know this is kind of leading to another question that we get all the time. It hasn't been asked yet, but I'm going to ask it for everybody because I know that's what they're thinking. Talk to me, Becky, let's start with you. Talk to me about how the financial structure works. And then we'll get into benefits afterwards, but let's go ahead and talk about how you get paid.
Sure. So you get paid hourly. Aspen has a very competitive, you know, hourly base compared to whatever the market is. It's different for every state, so I can't specifically speak to it, but it's very competitive. On top of your hourly, you know, so you're guaranteed a set hours depending on what you decide to. We offer both part-time and full-time hours. And so within those hours, you know, you're guaranteed that time. You're never asked to like clock out and leave early, or, you know, like take a longer lunch, or, you know, things like that unfortunately I've encountered in some other dental practices. So, you know, it's nice because those set hours are your hours. On top of that, then we do have a bonus structure as well that works really well. You know, it ties into the hygiene business that we are kind of speaking of. So on top of your hourly rate, then, you know, it's a percentage of your production, and then your budget comes into that as well. But there's some hygienists that definitely, once they're, you know, really learning how to run their business, can really make an extra incentive, you know, pretty big extra incentive off of the bonus structure that Aspen offers. So it's nice because it supports the hygienist a little bit more, you know, monetarily, and also it you know, incentivizes us to do what's right by the patient too, and just to, you know, kind of go hand in hand with that.
Yeah. Adam, anything to add about hours or compensation that we might have missed there?
No, I think that to dovetail off of what Becky said about you know, being asked to clock out early and things like that. What's cool about the business, the structure of running your business is you can still have, basically, if you're balancing the structure correctly, if you're balancing your business correctly, you know, if you have that hour, like a patient cancels, you know, and there's nobody you can move forward and you kind of have a dead hour there, you know, if you're balancing your business correctly, you can take that time off and you're essentially paying yourself from the business. So you can still it's like as if somebody had you clock out, but you're actually getting paid for it. And you get to decide if you want to clock out or not. And you actually get paid a little more if you do that. So it's just fun because like, instead of the negative of that, where you're never in control of your hours, when you get to run your business and you become more in control of your hours. And so, it's an exciting thing to do, and an exciting thing to be a part of. So I concur.
I love that. So you're saying, like, if there were no patients, which is rare, but
It's rare.
if there were no patients, you actually may profit more if you chose, nobody's asking you to, but if you chose to go home because of the way the incentive works, so that you might actually get a bonus. Like, you really know your bonus structure. I'm impressed.
Well, and that's the thing, is that you got to understand, how to do what's best for you and for the patient. And yeah, most of the time you don't have like empty slots, but if you have somebody cancel and you can't get out in time, it's like you can take a little bit of a longer lunch and treat yourself. It's just kind of cool, because that business structure gives you the autonomy, like you were talking about, to make those choices. So as a clinician, it's cool. Aspen doesn't hold your hand, and if you really take the reins with it, you really benefit from it.
That's so true. It's really neat to see too, because you watch people grow so much. Because I know, like, probably when you first started, you weren't quite sure about that. You know what I mean? And then as you grow and grow with the company, you start to learn more and more, not only about hygiene, but how to run a business as well. So really, really cool stuff. Becky, speaking of careers, can you talk about what an Aspen Dental career trajectory could look like for a dental hygienist?
Yeah, absolutely. Just to kind of piggyback off of my own experience with Aspen, I started with them about 4 years ago. I started as a float hygienist. So what that means is I live in Arizona, and so I would go around to different markets and fill in, or when people are on vacation and things like that. And so it was kind of cool, because I got to be like the superhero of the office. I would come in and everyone's excited and happy to see you, and you have a great day with your patients, and then you kind of get to go home and do the same thing all over again. I did that for about a year, and then I was a lead hygienist in an office in Phoenix for about 2 years. And then I recently moved up to what's called Territory Manager of Hygiene Support. So it's the best job, but I'm biased because I get to support all the amazing hygienists in Arizona and New Mexico, and really just help them to build their business and do what's right by their patients. It's a fantastic career. But throughout that career, I've figured out too, seeing other areas of Aspen, there's dental hygienists in all the areas of Aspen, and from finance to recruiting, I mean, just all over. So, whatever you want to do, if you want to stay clinical your whole career, that's great. We definitely want those people too. If you want to move up and train and develop, or do my job, there's definitely lots of areas of opportunity. And Aspen respects you as the expert in perio and what you offer as a hygienist, and they value your feedback in all the areas of the company.
Yeah, I will say you can literally do anything. If you have an interest, if it doesn't exist now, it probably will later. So
yes.
Yeah.
Even on my last AMA, there was, we were interviewing someone, and she was in her RV because she wanted to travel in her RV. So she took a role in recruitment as a hygienist, where she could travel the country and still do her work as long as she had Wi-Fi.
Wow.
So
that's amazing.
Awesome.
Yeah, it's literally everything. I know, Adam, that you love your clinical role, but when you think about the future, is there anything that sticks out for you?
I love working with people, and I've had a really, it's been a blessing to be able to kind of get in when I did, to be able to see how New Mexico was structured and built. And so I got to help open Clovis, I opened Santa Fe, I opened Albuquerque, and then I got to train some folks, and I've gotten to work with a lot of different dentists, so owner and associates, and so I really like the people that I work with, and then all of us that work together. It's pretty awesome to see that quality of person all the way through, because I've met everybody all the way to the top, and not everybody, but key people all the way to the top, and it was a delight all the way through. And you know, a lot of times you meet somebody who's, you know, the CEO or something, and you're like, that, you know, they don't have time for you, you know, and that's not been the case. Everybody I've met has taken the time to shake my hand and taken an interest. And so it's cool because I love what I do clinically, and I have, you know, with my wife and my small children, like I don't, you know, travel's not in my immediate future, but it's cool to know that, you know, that's on the horizon if I want to. And I would love to work with more of our structure and kind of helping people build their careers like you guys do. It's cool to know that that option's there, you know.
And you kind of already do it through the training from what it sounds like.
I do. I've had the opportunity to do a lot of training, and I have traveled a little bit in state. And then I've gotten to represent Aspen for my school that I graduated for, and I've gotten to go back and speak to them twice with two different regional. I got to go back with Ryan one time actually, and which was awesome. And then with another regional manager, and so it is cool. You do get opportunities. So even if you do need to stay a little bit close to home, you still get opportunities to grow and expand as a clinician. So yeah, it's a cool structure that lets you really reach your full potential.
And I know you were talking earlier before we got online, you even grow clinically. Like right now you're trying out lasers, right? To look at what we're doing company wide, and also a lot of CE and different things like that kind of help us grow too. So it's really exciting. No matter what you want out of it, there's probably a place for you. So really neat to see that. Sometimes you feel like you outgrow a place, but if you can outgrow a position here, but you don't outgrow a place, it's really exciting. A different view on dentistry, really. So I love that. Thanks for sharing a lot about work, kind of culture, I think. Becky, talk to us about work-life balance and what we can do at Aspen to help with work-life balance.
Yeah, so Aspen's big on work-life balance. You know, we really believe in giving our whole team and, you know, and our providers the opportunity to do that. We can't be our best if we don't have that, you know, have that balance. So you know, we do give, you know, paid holidays off, and, you know, after a certain amount of time you get vacation time and pay, you know, all of that, because we really do want you to have that balance, you know, as well as we do have some, you know, providers that have, you know, small children and they have to leave or come in at a certain time. We definitely work around that because we want the best. And so, you know, we're willing to do what it takes to have the best, you know, providers for our patients. And so, you know, work-life balance is what makes us our best, having that.
Very good. Adam, I got to ask you the same question because we were just talking about how you've got 3 car seats in your back seat right now, the cutest back seat in all of Albuquerque. So talk to us about work-life balance and how you make time for your family with Aspen.
Well, my wife is a superhero because she holds it down at the house quite a bit. But what's cool is I get to help out a lot more than I would have thought. You know, Aspen and my office helps make sure that I'm able to get home to my family a lot. That's why I don't, you know, that's why I have a home office, and I get to get my full amount of time, my full, you know, 40 hours. But there's a lot of, you know, when we're talking about work life balance, it's not just a catchphrase that Aspen throws out. There's been situations where, you know, I've needed to have a little bit of time off for my family, or I've needed to get out a half hour early or whatever, and we've been able to restructure my schedule. And it's about, you know, making sure that you have the time for your family or for your priorities, because that's what we're working for, is to be able to do the best we can in our personal life. And then it's kind of a catch-22, because then you do the best you can in your work life, and you're doing the best you can for these people that you're working with, these patients that you're partnering with. And so you want to find that balance where you don't have to feel like you're constantly working and just burnt out. And it's just awesome because I can genuinely go to work every day and say I love what I do, because I just don't ever feel burnt out. You know, I can work really hard, and we always make sure that there's a balance there. whether we need to bring in a float hygienist, which the company provides float hygienists so that, if somebody does need to take some time off, or if we need to just have, an afternoon off or something like that, somebody who's qualified and trained can come in, and we know that we're not, leaving our patients flat. So there's things like that. And then there's just opportunities with like a 401k and things like that to a support structure and good insurance that really helps us take care of our family. So from a dad perspective, I'm just really grateful because I get to do what I love, taking care of people, and I get to take care of my family in turn. So it's just been awesome. A+.
I love that. I love the grade, the A+ for Aspen, the A for Aspen. No.
It is.
But it's so true. I didn't really think about how much the health benefits and 401k and stuff, that's really part of your life as well. It's that stress at night that keeps you up. Am I going to be able to retire? What if something catastrophic happens? And it's nice to know that it's there for you, and it's good stuff, and you're getting a match on your 401k. And those are the things that do make, I'm a worry where they give me restful sleep. So that's a really good point to add that to the work-life balance. Kind of changing directions here. We got a good question about technology. And I know we talked about a little bit of it earlier, but I'll start with you, Becky. Talk to us about the type of technology Aspen has for you guys.
So we have a lot of the latest technology. We're very competitive with the dental market as far as that goes. Everything is digital. We have, digital paperless charting, digital x-rays. We also have a really cool iTero scanner that takes literally a 3D scan of the mouth, which is so cool. It really is an eye-opener to the patients when you're able to just bring up those lower anteriors and show them the tartar down there. It's no longer, handing them a mirror and do you see that? And they're saying yes and they don't see it, and so you're able to kind of, you're able to kind of show them
90 pictures.
Yeah.
If anybody's ever had to work with a intraoral camera before and take 100 pictures, sorry to interrupt, but
no,
this is way better.
Yes.
Sorry, Becky.
No, I have that same trauma, Emily. I feel your pain. I used to have to take 45 intraoral pictures.
Hold the mirror this way, and the patient's like,
yes. Yeah. So we have the iTero scanner, which is really, really nice. Also, as Adam mentioned, we're piloting lasers. So we are most likely going to have lasers in the very near future, the beginning of next year, which is so exciting because it's just an extra tool that we can have in our tool belt for our patients. So we have a lot of really, really great resources. We do, Zoom whitening, just a lot of great options for our patients to help get them, back to health, and as clinicians for you to stay current and relevant with probably everything that you learned in school. You can just kind of continue on, as opposed to my first job. I was in a literal developing room, like dipping and developing and processing x-rays. We don't do that.
No.
I was right there with you when the machine broke down. You had to hold it for all of the.
My thumb was in every image. I'm like, that's my thumb. It's not a tooth. Sorry.
There it is again.
Yeah, there's my thumb.
Now, Adam, you talk to us about technology, and specifically talk to us about your laser and what you're doing with it, because you're doing something really cool, which Aspen tries out things to see how they work in offices first before they spread it out to all the offices, because we've got 820. We want to make sure that it works well for an office before we bring it out. So talk to us a little bit about how the laser's going and other technologies that you like at Aspen.
So the laser is going great. I have been granted the opportunity to use a Gemini. It's a dual wavelength. So
fancy.
Yeah, it is. It's like the Ferrari of lasers. It's amazing. So Doc can use it for surgeries, and I use it for hygiene. You can use it for aphthous ulcers, and you can use it for sulcular debridement, decontamination. But essentially, it's just another tool to really get amazing results. Just quick breakdown. We can scale out the calculus and the tartar. We can, irrigate and then pack it full of antibiotics. But the bacteria that's super embedded deep, deep, deep in the tissue, that's hard to reach. And so with this diode laser, you're able to reach everything. You're able to really completely clean out these pockets and the surrounding tissue, and induce a faster healing rate, because the diode laser, basically at the wavelength we use, it induces little micro cauterizations, or little micro clots, and that produces excess fibrin, which basically supercharges your tissue. It makes your gums Wolverine for a little while, and you just supercharge, super heal. Now, is this too good to be true? It sounds like it, but it's not. Now that I've seen it clinically and I've done it, it's amazing. So it's been really cool to be a part of that pilot. My patients have benefited immensely from it. And so it's just cool to see some of that technology. They love seeing it. More importantly, they love the results. And I love the results, because I've had some, you have those cases, and you guys, whoever watching this as a student, you'll see when you get out, you have some people where, you'll see them on their return appointments, and you do everything you can for them. And you've done the SRP, and you've done the arrest, and God help them, they're trying, they're genuinely trying. And it's cool to have other things like this laser and see results where you never saw. You couldn't get that 5mm pocket to tighten up. And so between the laser, which gives you a better option in that regard, and then, talking about pockets that don't quite tighten up, we also do Invisalign. And so the reason I say that is because a lot of times, say you're working, and even with the laser, you still have an area that's just really complex for a patient. A lot of times that's because their occlusion is off. It doesn't matter how, much they go at it, they have to line everything up so that their occlusion is proper. And so we have that option as well when we're doing the dental health scans that Becky talked about. They get to see their mouth not only in 3D, but then we can run a simulator to line everything up and show. So part of that 3D mouth, you can see the occlusal pressure. And then we can zoom in and show where that pressure is, and you can take the pressure off, and they can see the little divots and the attrition in the teeth. And so they're like, oh my gosh. And then we as clinicians are like, oh my gosh, this is awesome, because I can see how this is happening. And so when we're seeing these buccal fives, these cervical breaks where everybody's like, well, you're brushing too hard with the brush. Well, they might be a little bit, but that's not what's causing it. It's the occlusal force that's flexing out the buccal portion of that tooth. And so we can see that and show them that in there. And then we can show them also what happens when you line everything up and the occlusion changes. And I know this firsthand because I'm wearing them right now. I have my Invisalign in right now. I put my money where my mouth is because I broke out a crown in front because I had an edge-to-edge bite. So the technology we have is awesome, because it can change your mouth completely. And I know because I'm the guinea pig for it. And I can speak sincerely to you guys, to whoever's listening. I can speak sincerely to my patients because I've done it. And I've done it at our offices and with different clinicians in our offices. And so it's awesome to be able to provide that opportunity for folks. And I know it works because I've done it on myself. So those types of things make a difference. And so those pockets will close up. You line up the dentition, everything lines up with occlusal pressure, and they have a new mouth. And areas where they couldn't reach before, they can reach now. And case in point, it happened for me. So it's true full mouth rehabilitation.
I love that. I love that our patients have that option to really get healthy and prevention. That's what we love in hygiene, right? Preventing things from happening. Mm-hmm. So it's so neat to see that we have the technologies, not only to co-diagnose or diagnose what's going on today, but to stop things from happening in the future as well. So that's really, really cool. You guys are so good at your technology. I'm like, oh, I didn't think of Invisalign that way. I love it. So last, or close to the last question, I'm going to ask you your favorite thing about Aspen. So I'll start with Becky, just because I just chatted in with Adam. So Becky, talk to me about your favorite things about Aspen.
My favorite things about Aspen, there's a lot of them. I love the support from every aspect. You know, like I said, starting from the beginning with the training and then the in-office support with just your doctor and your office manager and your team really supporting you. I love that part of it. I also love that I'm able to take control of my business and really do what's right by my patients. And I'm fully supported in every aspect to do that. I love that we stay up to date with everything that's the most current. Aspen offers, you know, free CEs, and a lot of them are on, you know, the AAP, you know, the new AAP classifications and just any new latest, greatest technology. They definitely make sure that we are up to date and, you know, on trend with all of that so that we're doing the latest stuff for our patients. And I just love how everyone is just so patient focused. You know, that's really from the top all the way down. That's what we're all focused on, is just doing what's right by the patient. And, you know, it really shows because, you know, everyone just really loves what they do, and they're there for the team and they're there for the patients. So that's probably my favorite thing about Aspen.
So then I have to ask you the opposite question. What is your least favorite thing about Aspen?
My least favorite thing about Aspen. Let's see.
It's that you don't have the swag shirt yet. I know that's what it is.
You know, I don't know. I wish you would have told me you were asking that question.
I know you're such an advocate. I had to ask because I was like, I can think of something.
My least favorite thing, to be honest, Aspen does dental like overseas trips once a year, and you know what I'm gonna say, Emily. And so they pick providers to go, and I applied, and they did not pick me, and I think they made a mistake. Because I wanted to go overseas and do that dental mission trip. It would have been so cool to help those patients.
Oh, well, after COVID's over and we get everything fixed, you apply again and show them this in your application so they know you meant it.
Yeah. Little video snippet of this moment.
That's really funny. I was going to say, because I used to try to diet, and you go in, and it's probably a little different now because I imagine foods, we don't want to share too much, maybe as we did before. You couldn't go on a diet because everyone's eating all the time. There is so much food in that break room.
That's true too.
That was my gripe. So Adam, I'm going to ask you the same question. What do you like the most about your experience at Aspen?
I would say two things that kind of go together. One is the opportunity that I've been afforded, like to meet you guys, to meet other people, to meet my patients, to be a better clinician, to have opportunities with all kinds of different technologies. And so just opportunity, like right and left. So that's really cool. And then the other aspect that goes with that is, you know, the fact that doing right by the patient aren't just words. Breaking down barriers and like having a culture of like a positive culture. I've worked a lot of places, and a lot of places kind of have their like logos and mantras and kind of like what they say is the goal, but putting it into practice is a lot harder. It's a lot harder to practice what you preach. And I love that I can be sincere and that I can be honest with our patients and with each other. And I feel good about this company. It's a career, and it's a company that helps me be sincere and be the best I can be at this. So I that's just been awesome. The thing I like least, there's one metric that bugs me, and that's the new patient show rate. Because sometimes you can't control that. But
I will bring that up.
But I will say this, and that's that as far as metrics go, it's sweet because the metrics aren't jammed down your throat. It's just a way for us all to grow as a company. And so I say that in joking. It's actually gets changed around all the time because those numbers are really cool, because there again, that's how I've gotten good at my business, is it shows me kind of aspects about that. But that's my gripe of the month, was was just that metric. Me and the manager joke about that, because you call them and they say they're going to be there, and then 2 hours later they're not there, and
you're like, why?
You said you were going to be here. But no, yeah, it's just been awesome experience, awesome ride. I'm Aspen Blue through and through.
Oh, I love that. I love that. Okay, final question. I'm going to ask you one word to describe, and I'll give you a second to think about it, to describe your experience at Aspen, or how you feel about Aspen. One word. All right, Becky, you ready for your word?
It sounds cheesy. Honestly, the thing that came to mind, and I was like, something less cheesy, but it's true. It's been life-changing for me.
Really cool.
Yeah.
Really cool.
Yeah.
Love that. How about you, Adam? What's your word?
A blessing. It's been blessing all around.
Yeah, I agree. Those are right kind of connected together. That's really cool. It's great to hear your genuine experiences. I know you two both personally, and you're nothing but genuine. That's one thing that made me really excited to work with you guys on this. So thank you so much for taking your time out to talk about Aspen with people that are curious. People that are curious, if you're on, please feel free. You can always email or email me, and it'll be in the link. You can always email me, and I can always get you in touch with these two if you have more questions for them. And you guys, thank you so much for everything that you do and for taking your time out tonight to do this with us.
Yeah,
No
thank you.
Glad to do it.
All right. Have a great evening, guys.
All right,
You guys
bye.
Bye.
Bye.